Hello, I'm Dr. Stacey Pfenning. I'm the Executive Director of the North Dakota Board of Nursing. I'm also a family nurse practitioner. And I'm here today with Kyle Martin, the Associate Director of the Center for Nursing. And today we're going to talk about health policy and how nurses can be active during the legislature.
So Stacey, tell me a little bit about how nurses can be active in health policy.
There's a lot of opportunity for nurses to be active in health policy. I think one of the ways of really diving in is to become part of the Center for Nursing workforce teams. That has been such a fun adventure for me in health policy and seeing how we really have the policy briefs that support nursing practice. And being a nurse for almost 20 years, I've just found the diversity of the practice has been so fun. We have nurses that can be healthcare providers at the front line, research nurses, administrators, teachers, consultants, and health policy advocates. We're just a vital part of that. So nurses diving into Center for Nursing work teams and also in the associations. I think one of my funnest experiences was going to Capitol Hill at Washington, D.C. last year with my fellow nurse practitioners, and we were able to actually visit on Capitol Hill our congressmen and talk to the staff about the issues that the nurse practitioners faced in our nation, especially with Medicare. So to me, that just felt really being front line change in the policies. So that was a really fun part. And I've heard you've had some really fun experiences in the legislature.
I used to actually work in the legislature years ago, back in 2007, and I was the assistant to the minority leader. And it was my job to research legislation and write legislation. So my first day on the job was kind of a test because my boss came up to me and he's like, I want you to write a bill that would grant universal health care to pregnant women under the age of 21. And I was like 23 years old, just out of college. I had no idea who to talk to about that or where to go. And that was kind of my test, was to figure that out. But it was a great exercise because it familiarized me both with our legislature, the legislative council, who is kind of like the lawyer team that works behind the scenes. They help draft a lot of the legislation that the legislators want. And it just kind of gave me a good idea of how to kind of get around the Capitol and how everything worked. So, what was really neat to see was just constituents interacting every day with their legislators. And probably the biggest piece of advice I would give people that are maybe interested in the legislative process, especially for nurses, if to jump on board our leadership team that we have with our advocacy. We have, during the legislative session, we have legislative calls, and that's just a great way to get informed. But also introduce yourself to your legislator. Our legislators are so down to earth here in North Dakota because they're our neighbors, they're our friends, they're our family. So introduce yourself to your legislator and just kind of keep track of the bills that they're working on each month. I think it'll make them more approachable when you do see them in person, and more likely to listen to your ideas or concerns, and take your ideas into consideration when they're making their floor votes. So, and we, one of the cool things that we worked on, not a lot of people know this, there is a deadline for legislative bills in the legislature, and I believe that's around the 20th of January, and that's the deadline where any legislator can submit legislation to the floor. However, the minority leader and the majority leader can submit legislation at any time. That's one of the special perks of being the majority or minority leader. And we used that actually to help a family that came out and visited Senator Conrad's office when I interned there. They came out and they wanted a special day of recognition for their son's disease. He had a very odd type of disease. It only affects like 1 in like 80,000 children. It's called Smith-Oemley-Opitz syndrome, and it affects your body's ability to produce cholesterol. So what they wanted is to do fundraising, and they felt the best way they could do fundraising was to have a special day of recognition in North Dakota. So they came to Senator Conrad's office just on vacation, and they asked us to help with that. And because we were federal, we couldn't help with that. But then when I worked in the state legislature, we were able to get that all set up. And it was really fun because the family came to Bismarck. They testified. We got the bill passed. It was passed by both the House and Senate unanimously. And it really did make great strides to help that family do more fundraising. So that's just an example of, knowing your legislators and approaching the right people, and how you can, make things like that were so important to that family done. So,
That's wonderful, and that's such a good example of how you can really be active in the legislature.
Yeah.
And we had a couple bills that came about with our reducing pharmaceuticals in our community workforce group, and that is a state-based workforce group, really looking at the opioid epidemic. And we had 3 bills come out of that, and it was really fun to be able to, as a provider, even be able to go testify and say, that, yes, this Good Samaritan law is so important because we've had people dropped off in the emergency room and left by their friends because they're concerned that they're going to be getting in trouble for any overdoses that occur. That was one of them. And the other one was the Narcan, having that on hand. And we've actually seen Narcan save a life. I worked in the emergency room for 12 years. And at the drop of a dime, people come alive and they're awake and they're feeling better. And we want that available more to the public. And then the other one was the prescription drug monitoring program that, as a clinician, using that program has really helped me understand how to prescribe to individuals the opioids that we see. All of the bills passed, and it was just it was exciting to be able to go testify, use my frontline experience, and that's what we definitely encourage nurses to do that are at the bedside, frontline. We see the issues. We know we can go and we can talk to our legislators and say, I've seen this work, and we know this will save lives, and this is what we've seen. And I think the most powerful testimony came from some of the individuals who've experienced it firsthand as patients, as an individual who had an overdose and was left by a dumpster, and it was just very powerful. But seeing the legislature actually working with the bills and passing them was so exciting.
Yeah.
And knowing that we're making a difference in our community.
So let's jump a little bit. Tell me a little bit about the Board of Nursing, what you guys kind of do, and how that also comes into play with the legislature.
Certainly. The Board of Nursing is the governing body for the licensed nurse, and the goal of the board is to really provide public protection. So the board always focuses on public protection and how we can make sure the licensed nurse is safe to practice and that the registration process is sound. And we have also in our Nurse Practices Act, which is a century code, talks about the duties of the board and the composition of the board. The board is composed mostly of registered nurses at all levels and also a public member. And then also the compensation for the board members, the licensure process. So we're making sure that all the licensees are educated the way they need to be and are ready for licensure. And then also compliance, making sure that nurses are practicing accordingly to the law and that they're compliant with the law, and also education programs. So we look at all that in the Nurse Practices Act. It's not a very long piece of law. It's, I think, approximately 8 pages. Okay. And so we have the North Dakota Administrative Code, which is the next step. It's the rules, and those really add a lot of substance to the Nurse Practice Act. It gives more details on nurse practice, the standards, the scope of practice, and education programs as well. So those are very important documents for nurses who are licensed to look at. And where the board comes in with health policies, we're able to look at the rules and standards and make sure that they're still fulfilling what society needs in this day and age. And as we all know, telehealth is becoming very big. The opioid epidemic is becoming big. So we're looking at laws and rules to help nurses and to help with the board to ensure public safety. And so one of the recent rules that the board has adopted and enacted is the PDMP, which is the Prescription Drug Monitoring Program. And it came from a bill that passed in the 64th legislative session where it charged all of the licensing bodies who have prescribers to make rules, so really to bring it to the rule level, which has the same authority as law, saying as a prescriber you need to do this, this, and this with the PDMP. And it truly is a tool that will enhance any clinical practice judgment. And so with that, the board developed rules. And we went through the whole process of public. We have to make sure it's noticed publicly, and the public has the ability to speak to the rules if there's any concerns. All of the stakeholders were included, and all of the other licensing boards came together, and we all looked at these rules. And then it goes through the time period where it has to actually be looked at, and allowing public to come in and do comment. And then once it's passed by the board finally, it's adopted, it goes to Administrative Rules Committee at the Capitol. So it went through that process and was enacted on October 1st, 2016. So it's fun seeing a bill go from law to rule and actually land right in the Board of Nursing Administrative Code.
Awesome. Well, I think that's great information for everybody that's watching today. So if you guys have any questions, feel free to contact the Center for Nursing. We have our contact information on our website at www.ndcenterfornursing.org. I'm sure, too, folks here at the Board of Nursing, too, would be happy to answer any questions that you guys have. But thanks for watching.
Thank you.